Welcome back to Ageless Anatomy Podcast. My name is Darcy. I am a certified laser technician here at Ageless Anatomy.
And I am Brooke Bangart, a certified laser technician as well as business partner.
And I'm Dr. Brianna Cain. I'm a board licensed naturopathic medical doctor here in the state of Arizona, and I'm also a partner at Ageless Anatomy.
All right, so today we're going to talk about GLP-1, which is the
weight loss,
probably the biggest
gaining
craze.
weight,
Yes.
weight loss,
It is.
gains, whatever.
Yeah. It's
Everywhere.
all over.
Yeah, so the thing about GLP-1 agonists, which are that group of medications that induce weight loss, is that they were primarily developed for diabetic use. And so I think Ozempic got FDA approval in, I think it was 2012 for diabetes. So it's been around quite a long time. It's not like a brand new drug. But it recently got FDA approval for weight loss in 2021. So that's when it really exploded and, got a lot of media attention.
And why do you think that is? Why do you think that happened all of a sudden with weight loss? And
I'll tell you a number of reasons. One is that a huge portion of our population in the U.S., I think it's over 50% at this point, is obese or morbidly obese. And so people are just really struggling to lose weight. They're struggling, and it's not always their fault, right? There's a lot of chemical factors that come into play, a lot of hormonal changes, this kind of thing. But it could partly be just because they have a bad diet and lifestyle. Anyways, the reason that these drugs got so popular is because it's just so easy to lose weight with them. You do a once-a-week subcutaneous injection, you really don't change anything else about your life, and you lose weight. I think
is that the case for everybody, though, or no?
It's not the case for everybody. I think that in the studies I think the average weight loss was 2 to 8 pounds a month was normal. Now, you see these very outlandish stories on social media and stuff where people lost 30, 40 pounds in a month or two. Mm-hmm. That is unusual. That's not the way they typically work. However, there are people who are non-responders to some of the drugs too. And since Ozempic came out, there's a lot of other GLP-1, GIP, and glucagon agonists that are on the market. So that'd be things like Mounjaro, for example. There's one called liraglutide. There's one called retatrutide. There's all these different... Tirzepatide is Mounjaro, yep. There's all these different ones now. And so we found that if you don't respond to a traditional GLP-1 agonist like semaglutide or Ozempic, they're the same drug, by the way. People seem to think there's a difference, but they're not. Semaglutide is the generic word for Ozempic. If you're not a responder to that medication, a lot of times if you try one of the others, that'll work for you. Here's my problem with GLP-1s. I think that they can be very useful for some people, and the risks compared to staying obese are low. So people who really need to lose weight are at high risk for things like cancer, cardiovascular disease, diabetes. And if they just cannot seem to get their weight under control on their own, the GLP-1 is a good option. Now, I do think that losing the weight a little slower on these medications is beneficial because that gives your body time to catch up with the change in your weight and adjust its natural metabolism. If you lose too quick, it can be very difficult to maintain once you're off. Now, here's the other side of it. Because we've had such environmental influence on obesity, such as chemicals in our food, which has caused changes in our hormones, and a lot of people are just becoming kind of stagnant, not exercising enough, not getting enough activity, it has literally changed genetics over time. So people can actually pass on genes to their children that make them fat. And that's not something that they can control, right? So for people who have alterations in their gene expression or their epigenetics that creates obesity will not respond to just a low-calorie diet or be in a calorie deficit with exercise and lose weight. Those people have a medical condition and need a medication to treat it. And that's where GLP-1s enter. So, for some people who have high blood pressure, for example, they have to be on a blood pressure lowering medication. It's the same in this case. These people have the disease of obesity and they need a medication to treat it. And for those people, it's likely they will have to stay on the medication forever. Now, if you're not one of those people and you do respond to calorie deficit, I encourage you to, if you're going to use one of these medications to get to your weight loss goal, that you use that opportunity to really dial in your lifestyle. Take that opportunity to get used to eating less, get used to moving more. And then when you come off, you're more likely to maintain it, but also losing slower. So I advocate using the lowest dose necessary of these medications to lose weight. So they're traditionally designed to, you take one dose and then in a few weeks you go up to another dose, and a few weeks you go up to another dose, and you kind of stay on this trajectory. You do not have to do that though. You can, if you are losing weight at the entry dose, stay at that dose. You don't need to go up as long as you're losing the weight. The higher you go, the more risk for complications. So, you've seen in the media people who've ended up in the hospital because of, they got where they had no movement in their GI, because it will slow down the way the GI functions. And then they ended up with surgery, or, they got septic from a colon rupture or whatever. And what I found is a lot of these people are abusing the medication. They're not using it the way it's prescribed. They're using doses that are too high. They're exceeding the maximum dose, and that's when you get into trouble. And I think people do that because they get addicted to that weight loss factor. And there is you do build some resistance to the medication the longer you use it. So your appetite starts to come back. You start to be able to eat more again, even while you're using the drug. So people will go higher and higher and higher. But you use those first few months to train yourself to live a cleaner lifestyle. So it's in that way very beneficial for people. And I would say for the majority of people, there's been more reward than risk.
So would you recommend for some people cycling on this medication so that they have breaks, or if they have a lot of weight to lose? Or
Yeah, so I don't necessarily think that they need to cycle it, but really when they get to their goal is when they can reduce it to sort of a maintenance strategy, where they're either injecting a very low dose once a week or every other week to help maintain their weight loss. There's a lot of other benefits to these medications. There's a lot of research being done right now in the role that insulin resistance plays in dementia, Alzheimer's, Parkinson's, even in some inflammatory joint conditions. And so they're now, researching the use of them to make those tissues more insulin sensitive and reduce inflammation in the body. So I have some patients that will come in and they're not really losing weight on it, or they don't use it for weight loss, but they just feel like it really helps them to be less inflammatory. They have less joint pain, they have less bloating, a lot of these things. Now, this medication has a lot of GI side effects. So that's the other piece, is you really want to make sure that your GI is in good health before you start one of these medications. And then there's a whole, lab workup for these people. I don't think you shouldn't walk into just any old clinic and get a prescription for it. You should be worked up to make sure you're a good candidate. But I do think that there is a strategy to maintenance with it. If it's the situation where you are in that category where your body's genetically designed to hold on to weight and you just cannot keep it off without the medication, then you can use it in a different way to maintain.
And most of the time there's something else going on as to why.
Usually. So if it's not that you're just wired that way, you definitely could have some kind of hormonal imbalance or other nutritional deficiencies, or, some disease process going on that's preventing weight loss. And that stuff should be worked out initially with your doctor before you start the medication.
So like you had mentioned in another episode that kids can be born to be fat or something, or if it's it can be in your DNA.
Yes.
Yes. How does that work? Like, what happened to where that is happening?
Yeah, it's almost like an evolutionary process, right? So people get used to eating poorly or being exposed to a lot of chemicals in their food that are endocrine disruptors, or even chemicals in their environment, and they're very sedentary. So those people, they live their life long enough that way that it starts to change their gene expression.
And then they have kids and it's that way?
And then they reproduce, and their children also
I think it's a lifestyle too
adapt
that they live.
those genes that get expressed in that negative way. So you can you definitely can pass on obesity to your children.
Scary.
Well, it's almost, so let's just say years ago, my family, they were farmers and they ate really clean food, right? They did. They grew gardens and in great soil, and back before it was contaminated, all of that stuff. That also will play an effect on how.
Yes.
Oh, wow.
In fact, there's a lot of there's research about that too, about the way that your ancestors ate influences your health today. There's a great book about that DNA expression, and also about passing it on to future generations, called "You Are What Your Grandparents Ate," and it really talks about how your parents and your grandparents took care of themselves and how it influenced your genes today.
Interesting.
So when things switched over to the 70s and we were eating Swanson's TV dinners, that was a bad thing.
That was bad. That was really bad. Because not only is it processed food, and I don't know if we could even call it real food, right?
It was in metal, though. It wasn't in plastic.
But it now is in plastic,
Oh,
right?
it is.
So it just keeps getting worse, right? It's not real food. It's highly processed, full of chemicals, and now we're adding plastic to it. And people are putting it in the microwave and heating it in the plastic. So
Which is the worst.
Just a
It
compounded
used to be
effect.
where it was in tin foil or whatever
Yeah.
it was in, and you put it in the oven, and then all of a sudden, you're right. Microwaves came around. You couldn't do that anymore.
Which even aluminum foil has its issues too. So I think you could do a research study where you could see a trend between the evolution of TV dinners and obesity in the country.
Oh, my gosh.
Wow.
So you have 4 kids. You better act right. Your kids work out really hard.
Well, here's the
We don't eat
positive
TV
thing.
dinners, so we're good.
Here's the good news.
Dinners.
Here's the good news, though. If you do it right, you can change that, right? You can change your gene expression. So I think that at this point, the last I heard was that disease is typically about 80% epigenetics and 20% genetics. We can change epigenetics. So the majority of the influence on obesity, cardiovascular disease, diabetes can be altered through lifestyle. So if your parents had very bad habits, but you adopt good ones, then you'll pass on good genes to your children.
Oh,
Right?
thank you, Jesus.
That's screwed.
It can be reversed. It can be reversed for sure.
Actually, I mean,
And maybe GLP-1s have a role in that. Maybe we're at a point now where if enough people use it and they start to transition back to, living in a state of normal body weight,
Right.
that we'll have healthier future generations. I don't know the answer to that. I do think that there is a place for these medications, though, under the guidance of a physician.
Right. Not being abused.
Not being
Not
abused.
ordering it online.
Because there are side effects to them too, and one of the big things that we're concerned with is the change in body composition with their use. Because not only you're losing fat, you're also losing bone and muscle.
so how do you keep that? How do you balance that
Right.
out when you go along?
Great question. So one is by losing the weight a little slower. 2 is to exercise with the emphasis on resistance training. So you're maintaining your muscle mass, supporting your muscle mass with good nutrition, eating enough protein, and making sure that your hormones are balanced.
So how do you know that enough is enough? So if you're going to a doctor like you, do you write out a different plan for different people, or is there just kind of a certain...
Yeah. So there's a kind of a general guideline, but depending on your age, your weight, your activity level, I'm going to give different recommendations for the amount of protein you should consume, for
That's
example.
what I was going to ask. Well, how much protein?
I don't even know how much I'm supposed to be eating.
Well, we had a client come in yesterday and said that a doctor told her she needed to eat 150 grams of protein a day. And I'm like,
You should eat
almost impossible.
You should eat 0.8 to 1.2 grams of protein per pound of body weight. So nearly your body weight
There we go again.
a day in grams of protein, yes, for most people. Now, if you're morbidly obese, that can change, and that's a different situation, and that's a conversation that I have with patients. But for most people, that's a good recommendation.
So a lot of these people who don't have a lot of weight to lose, and they just keep losing and losing, that's when it starts getting into muscle and that other stuff, because it has nothing else to take, or does it just not know how to decipher, regardless of your weight.
So this is a little more complicated. It has to do with blood sugar metabolism and how different tissues utilize glucose. So it's not specific for fat reduction. And really no diet is because of that glucose metabolism process. So no matter what diet you're doing, you're going to lose some lean body mass.
Okay.
But the problem is that with these medications, you're losing so fast that some of what you lose is going to be lean mass no matter what. And so we have to do everything we can to try to maintain it.
So that's why you talk about slowing it down and losing.
Yeah.
Yeah.
Losing at a slower rate not only helps your body to adjust to that weight loss and be more likely to maintain it, but then you're more likely to, just be breaking down mostly adipose tissue and not as much muscle.
So another thing, so with what, Darcy and I do, as far as aging on the outside and working with skin, I've heard all of these things, people having Ozempic face and Ozempic body, but to be honest with you, I know I have been in the office with you. I know we have a lot of patients on this. I have been on the semaglutide or Ozempic myself for a long period of time and am on a maintenance dose because I do have that inflammation in my body to where from an autoimmune that I have, and it does help me feel better just not having that inflammation in my body. I have not seen any of your patients, maybe I'm missing something, Darcy, because we work on a lot of them, that have this, whatever they're calling Ozempic face and all of that. I've been on this since 2019, and I'm 57. I don't feel that anything else has changed in my skin or my body, to be honest.
I personally think it's the skinnier people who want to lose the weight who end up losing way too much, and then they literally look like skeleton
Are you
face.
saying I'm not skinny? Because I'm like, I went from 138 to down to like 120, which I feel like my perfect weight with my bone structure and how I feel, that to not be above 125 is where I feel the best.
Well, okay, so there's a few things that we need to address here.
Okay.
So about the Ozempic face, we'll come back to that in a second. But one thing I want to point out about weight is that the scale is not always the best representation. I would encourage people to have a DEXA done or even go to like your local gym where they have an in-body so you can see what your body composition is. Because the problem is that some people, especially here in the Scottsdale, Phoenix area, we have people with quite a bit of body dysmorphia, and they get to the point where they're very thin, they look good, but they want to lose more. They get addicted to that weight loss. And yes, I would say it's the skinnier patients that don't really need to lose weight, that start losing a lot, that get that very gaunt look, that Ozempic. I personally discourage those patients from using the medication, or using it in a way where they're going to lose a lot of weight fast, and then that contributes. So I think, the scale is one parameter to gauge weight loss. But I think knowing your body composition is really important because you can weigh 125 pounds and have no muscle and be,
right,
very thin. Or you could weigh 150 pounds and have no fat and be very have a lot of good musculature. And you're maybe more healthy than that person that only weighs 125 and has no muscle. So I think knowing your body composition is important. And the scale, don't get too addicted to what the scale is telling you. I also don't think people should weigh themselves every day. It really messes with their mental health. I think once a week or once a month is a better strategy there. But I think as far as Ozempic face goes, yes, it's more those patients that are skinny and want to lose more weight and they don't need to, or it's patients that have lost very fast. And that's the same with any diet, right? You're going to lose tissue, adipose tissue, everywhere. It's not specific just for your abdomen, right? Or your arms or your hips or whatever. You're going to lose fat in your face, and fat in our face is what keeps us youthful. So that's where no matter what diet you're using, if you lose too fast, you're going to lose that tissue in your face as well. And also women will complain about their breasts shrinking, their butts shrinking, because again, it's not specific for one area.
Yeah, I think when I was on it back during COVID, when the gyms weren't open, I have to agree with you on that. That was when I started kind of gaining a lot of weight when I wasn't active at all. Literally came to the office and would go home and it was the Hallmark Channel and TV with pasta and stuff, which I never eat that stuff, but it was during that time I was craving all of that, and I felt horrible. So I did go on it back then, and actually early 2020. And I did feel that I lost muscle. I wasn't sure if it was from that or just, I went from lifting 6 days a week to nothing, and then it was just really hard for me to get back after that. It was
probably a combination of things, honestly.
Yeah.
Being inactive for a while, the GLP-1, hormonal changes, stress. Stress will wreak havoc on your body, especially for women. Once we get past menopause, cortisol just runs amok. Like it's really can be difficult to manage and can really contribute to changes in blood sugar. So it's probably a number of factors that contributed to that situation. And I think a lot of people are in that situation. And also it's hard to break a pattern of poor eating and poor lifestyle. I think I read once that it takes 21 days to break an addiction to sugar. It's almost like a drug. And when I say sugar, I'm talking about refined carbohydrates. So anything in your diet that's white flour, white sugar, white rice, all of these things contribute to an unstable blood sugar and then, fat deposition. So probably a number of factors contributed there. So again, it goes back to taking a very holistic approach to weight loss, even if you are using a GLP-1.
It's a lifestyle change.
It's a lifestyle change. And it should be for everybody. It's an opportunity for you to,
reset.
Kind of get it together.
Reset, right?
Yeah. So.
Okay, so that wraps up our podcast about GLP-1s with Dr. Cain. So stay tuned. Thank you for joining us on Ageless Anatomy Podcast.